Cases of COVID-19 surging again in Oregon. Well, experts now warning that if we don't change our behavior, that trend will only continue.
Our Lindsay Nadrich got an update today from the Oregon Health Authority.
After seeing a significant drop in cases 6 weeks ago, the Oregon Health Authority says case numbers are now back to what they were in late July and early August. In fact, cases have risen by nearly 25%.
Last week's total set a new high for the pandemic. On 3 consecutive days last week, we exceeded 400 cases, including a record daily total of 484.
OHA says Oregon's rate for positive testing is also at the highest point since the earliest days of the testing program, when fewer people were tested. So what does this mean for all of us? We cannot ease up on social distancing, mask wearing, or hand washing. I know a lot of people are tired of this, myself included. I want to go back to normal and hang out with people more often. But health officials say social gatherings are still the #1 reason COVID-19 continues to surge.
I think people are really focused on my kid or myself and what are the chances that I'll have a bad outcome. I'm willing to take that risk. And people, I think, really still are not thinking about the risk of giving it to others who are vulnerable.
As you consider your own risk for COVID-19, OHA Director Pat Allen says you need to consider that you could get COVID-19, not know it, and pass it on to somebody else. New data shows that a person with COVID-19 is now infecting multiple people, not just one other person.
I think that's the challenge getting people to understand is they're taking the risk for their whole community.
Hospitalizations during the past week were the highest we've experienced since mid-July. A look at hospital capacity data for the area that includes Multnomah, Clackamas, and Washington counties shows 295 ICU beds are occupied and only 54 beds are available. However, unlike at the beginning of the pandemic, OHA says hospitals have the ability to add more beds if needed.
That said, we're on a track that we would rather not be on, which is hospitalizations increasing.
OHA also recommends getting a flu shot so hospitals aren't overwhelmed with flu and COVID patients. And despite what you may have read online, OHA says there's no evidence that the flu shot could cause people to be more susceptible to COVID-19. I'm Lindsay Nadrich, KOIN 6 News.